I got my first bra when I was about 10 years old, and I still can't fit the bra. I got bullied, I got teased, I was called Berry Chad, especially in high school, when a boy that you liked didn't really like you because you didn't have, you know, the big fluffy breasts like all the other girls. In class, I'm constantly doodling breasts. Like in class, I would zone out and just start sketching breasts on my classwork. I would just miss the entire assignment. I've tried a lot of different types of padding to make myself feel better. I collect magazines. Those look really nice on me. Like window shopping for breasts. Actually, I got into more fights about my nose than I did about my breasts. I used to go home crying, saying, oh, I'm ugly, they say I have a big nose. This is something that I've had to deal with. But I've cried so many tears. I don't want to cry anymore. My pillows are soaking. My pillows are soaking. I just don't want to cry anymore. But God has his ways of answering your prayers. Ricki, you're changing my life. Thank you so much.
Well, you know what? Let's meet Kimisha now. Kimisha, come on out. Ladies, I want you to meet Dr. Alan Engler. He is a plastic surgery genius who is about to change your lives. Dr. Engler, tell us a little bit about what we're going to be doing here.
Well, all three of these women have been in my office, and we've had some good consultations with them. I just want to point out that, first of all, these are compelling stories. I think we've heard from them. These are not rash decisions. They've all done their research ahead of time on the Internet. They came in knowing not just what they wanted, but what was really appropriate for them. And I think that's really to your credit that you come in that way.
They are good candidates.
They're excellent candidates. They're in good general health, and the procedures they've chosen are really appropriate for what they want. I think they're going to be very happy. I usually tell my patients, you might hate me for a few days, and then we'll be friends. So there might be a few days where they're not so great, and after that, everything will be wonderful.
Are there huge risks involved?
There are risks. We do everything possible to minimize the risks. As Marlene pointed out, there are risks in everyday life. Every time you cross the street and do anything like that, there are risks. And we will do everything we can to keep those minimal. The surgeries are done appropriately under an accredited facility with intravenous anesthesia.
Well, you've done magic with us before, so we're looking forward to see what you do with these ladies. Marlene, Jennifer, and Kimisha have waited their whole lives for bigger breasts and more perfect faces and bodies, and now their dreams are about to come true. But plastic surgery is not pretty. Stay with us as we show you the minute-by-minute reality of the journey these women are about to go on, from pre-op to recovery, and finally, the big reveal. And I mean big. Don't go away. We'll be right back. Astonishing plastic surgery makeover for you, and it's a big one because Vivi's best friend Kimisha wanted both breast implants and a nose job. Let's see how she did when it came to going under the knife.
Basically already looked at myself and say, goodbye old you, hello new me, I am ready. I am ready, my wardrobe is ready, I am ready. I've been waiting for this day forever. I bought these outfits in the hope that one day I'll be able to wear them, and today is the beginning of those days. This I can't wait to try on when I get back. And these, I can't wait to not try them on when I get back. I'm freaking out. I'm really nervous because it's like, it's finally coming true. Oh my gosh, I've waited so long for this.
This nipple's a little higher, so I'll try to even that out during this.
Kimisha is going to be having two procedures. The first is breast enlargement, and the second is rhinoplasty, which means plastic surgery of the nose. Okay, Kimisha is nicely sedated now, and we might as well start. Okay, so we finished with the breast, and now it's time to do the nose. In her case, she'll be having 3 maneuvers in particular done. One is to narrow the bridge of the nose. In addition, I'm going to take out some of the cartilage from the tip of her nose, and the last thing I'll be doing is to narrow her nostrils a little bit. Now I'm going to prepare to break the bones. What you're really doing is repositioning the bones. I think everything went great. She's going to have a fabulous result with this. I think this will only enhance her, both physically and emotionally. She's going to look better instantly, and partly because of that, she's going to feel that much better about herself.
You have some visitors here.
But you got boobies! You got boobs, Kimisha!
It's been 3 weeks. since my operation, and I can't believe how my life has changed. I have all these clothes, and I'm just so excited. I can't wait to just wear these. Now I can actually dress the way I always wanted to dress. Before, guys used to look at me like, she's pretty, but her nose is too big, but her breasts are too small. And now when I go out, it's like they don't see that. They just see, wow, she's attractive. I have a whole new confidence now when I look at myself.
Well, without further ado, let's see Kimisha.
Check me out, check me out.
Look at you, honey. Oh my goodness. How do you feel?
I feel great, Ricki.
You say
have no
guys
idea.
are all over you because of your banging body.
All over me, Ricki. I got it going on, okay?
Oh my
I got it
goodness.
going on.
And so you're happy with both the boobs and your nose?
Everything. My teeth, my nose, my boobs. I'm just so happy.
Now let me just say, the nose takes a year for the swelling to go down?
Something like that. Some parts of it a little bit faster and some take even a little bit longer. But yeah, she's still got more to go.
Oh my gosh. Was it painful? What was worse, the boobies or the nose?
Honestly, I really didn't feel that much pain because I took my medication on time. Dr. Engler was, he made sure that, we were comfortable. My nose, it really wasn't that painful. It was just like to see the bandages on my face. There was no real pain. There was no real pain. Just soreness and a little bit of discomfort.
Anything you want to say to the doctor?
You rock. I love you so much. He is the best. He is the best.
It is amazing. What gratifying work you do, Dr. Engler. How many surgeries do you do in a day?
Usually one or two of the larger procedures and maybe some small procedures in the afternoon. I don't actually like to do too many in a day.
And over 3 days you did them?
This was actually over 2 days. It was sort of a marathon session. We did Jennifer the first day. That was about 5 hours of surgery. And then Marlene and Kimisha the next day. About 9 hours of taping altogether. But they did great. They went through a lot and they all did great.
And it all paid off. They look fantastic.
I think so.
Very happy with your work. We sure are. Thank you so much. We'll be right back after this. Don't go away.